Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Hello, everyone. I am August Oliveira. I got snuck onto the schedule. So I'm going to be talking about hybrids. It's really hard to make people with perio funny. So I'll see what I can do. But my name is August. I'm a dentist from LA. I'm here to talk about digital hybrids. I've been involved with digital dentistry since 2005 when I bought my first CIREC. You may or may not have seen the website Digital Enamel. Do check us out. So I've got a running joke with a few of the guys here. When you go online, one thing I love about sharing my work on Facebook and social media is the back and forth and the interaction I have with other people. There's a few internet personalities that are maybe withholding of their information. So they always tell you, take the effing course. So I'm not going to do that for you. I only have 30 minutes, so please come find me later. I'll set up shop at the bar. If you ask me a lot of questions, you'll have to buy me an appetizer too, but let's get going. So I do teach courses. We've got a 3-day digital dentistry course at the Brighter Way Clinic, if you're not familiar. It's a clinic associated with a homeless shelter in Phoenix where anyone can do dentistry with any valid U.S. license on the homeless. And so it's 3 days, guided surgery, scanning scan bodies, scanning hybrids. I also teach a course called a 3D printing party. If you ever see some of my stuff on Facebook, I am a 3D printing nerd. And so I'll show you some of the stuff that we do with 3D printing and hybrids. The next one is in sunny Minneapolis in the dead of winter. So I know it's tempting, but it's January 17th and 18th. So digital hybrids are a big challenge for me and a big struggle for me. So being involved in digital dentistry, I've wanted to do hybrids without models. And if you guys are not familiar with the process, it's the corrected cast technique involving multiple appointments with jigs and pickup impressions. So I always hope that I could somehow find a way to do this all digitally, but there's lots of questions that you have to ask. Depending on which scanner you have to scan patients a certain way. CIREC likes data a certain way, will only accept the bite in certain catalogs. Same thing with 3Shape. Some of the newer, more exocad-based scanners really don't care. Just take a scan of this, take a scan of that. The lab will match things up. So knowing your scanner is important. What's the AP spread? I know that's a very, very basic thing, but you really have to respect certain materials. Pecton can't tolerate a normal 1.5 times AP spread. How do you get the bite? This is actually the most challenging aspect of digital hybrids. We know how to get the bite normally with a conventional hybrid, but how do we transport that information into the software? Materials. There's a ton of materials out there. Zirconia, Pecton, acrylic bars. Which one do I use and when? Which software to use, exocad or 3Shape? I have both softwares, and I will tell you, they're a bitch to learn. And certain labs only use certain types of software. So obviously, if the lab uses 3Shape, you can export to STL, but it would rather have the native file 3.oz. So you need to really talk to your lab and see what software they use. Do you want to go multi-unit attachment level or fixture level? Spoiler alert, my personal preference is multi-unit attachment level. It's just a little more dummy proof. What is photogrammetry? That's a big word. Do I need photogrammetry? Well, yeah, you do. And so we'll be talking about PIC and iMetric later on. And finally, what can I farm out? If you go online and see some of the online personalities, a lot of them are big on stacking your own porcelain, milling your own zirconia, learning milling strategies. I don't want to deal with that crap. So I'll talk about some different options you can have to maybe print try-ins, send stuff to designers overseas for not a lot of money, or just send to a good lab and let them deal with it. All right, so the promise of digital dentistry, right? People hate messy impressions. The promise of digital dentistry is higher accuracy than PVS. Whether that's true or not, I don't know. There's certainly conflicting. I just love this. You ever have those patients like Karen that say, "Oh, I hate that assistant Maria. Can you take the impression, doctor?" Well, hell, it's been 23 years since I took an allergen in dental school, but let's give it a go. But no, the accuracy of digital impressions is touted all the time. But if you look at the actual literature of digital hybrids, it's very, very sparse. Some people say, oh yeah, I do it every day, no problem. Stick some scan bodies and scan it, you're done. Others say, hell no. So what do we need to do to get accurate digital impressions for hybrids? As I mentioned before, CEREC takes information a certain way. 3Shape also takes information. One thing, I have a love-hate relationship with CEREC. I've been using it forever, but I really hate the mindset of their programmers. So in CEREC, the only way to get a bite, and we'll talk about scanning a pre-op bite, is to call your initial hybrid an upper and lower and bite, then stitch different catalogs into that bite. So it's really kind of annoying. 3Shape's the same deal. You can see these funny white marks that we put on teeth. They're basically fiducial markers for an intraoral scanner that allow us to match the pre-op bite to the scan body scan. How do you get a pre-op bite? There's lots of different ways. If the patient has a converted all-on-4, a converted set of dentures, that's the easiest and best way to go. So there's a lot of push to take a patient with a couple of teeth, do the all-on-4 surgery, and somehow magically get a set of hybrids. It's really not the way it works. There's so much blood that can get in the way of doing a scan. So the best way, old school, punch a bunch of holes, convert a denture, get the patient healed up, bring them back in about 6 months after the gums have healed nicely. Now you know some information. You know the patient's vertical, you know where the midline is, you know the gingival display. Scan that and have the lab use that as a guideline. Do you want to be a do-it-yourselfer? So do you want to mill things? I don't know if many are familiar with milling centers like Alien Milling. They can mill things out for you for really, really cheap. I want to say a hybrid is about $800, but you have to have it designed. And there's a number of Facebook personalities that can design for you. Kiki is my girl. Not the Kiki, do you love me girl, but Kiki. If you go on Facebook and friend Kiki Zoe, she is a digital designer. She works primarily with 3Shape. She can design hybrids for $50 an arch. She is magical at single units. So $2.50, you give her an STL. By the next day, she'll not only design the crown, but give you dies and analog or single unit models that you can 3D print. Daniel Porter used to be head of customer service with ExoCAD. He now has a design service. Daniel charges $150 an arch. I did a bunch of hybrids, about 8 arches that are all going in 2 weeks on the CEREC Prime scan. So he did some of the design. So I'll be posting those on Digital Enamel. So if you check us out on Facebook. Jacob Farber is the granddaddy of all designers. And he has kind of a fun, and I'll just tell you a very quick story. He was a dentist in Miami and such an occlusion hanky-panky nerd that he also set up a lab. And he was a resident of Belarus, just north of Chernobyl, when the meltdown happened. And he got to the US. And after a while, he says, maybe the radiation has died down. I think I need to retire. So he moved back to Belarus. And he decided he was just bored off his ass. So now all he does is design hybrids for people. He charges $300 an arch. He is a nut about occlusion. I mean, every single hybrid we inserted designed by Jacob was like magic. And so if you don't mind spending a little extra money, Jacob is, and I'm sure these other people will admit, the best digital designer out there. Okay, so let's talk a little bit about scan bodies. I'm not going to spend too much. On my favorite list is I would rather have a complete metal sandblasted scan body, or at least a scan body with a metal insert. So these are Implanter X smart bases. The multicolored tie bases should be FDA approved and coming to the market soon. But what I like about them is they have a metal insert. You want a metal insert because these get sterilized and peak and deform. So you want to make sure that it goes in and it stays in, and you can take a radiograph to verify seating. DES is another great company. We're all big fans of DES. If you're not familiar with DES, company based in Spain. They make a lot of implant parts, abutments, and whatnot, but they make a lot of scan bodies and tie bases. Initially, all of their scan bodies were made out of PEEK. Can't take an x-ray of it, and multiple sterilizations will actually deform them. They have moved to an all titanium tie base, which is awesome. And so if you are going to be buying scan bodies, I will say buy DDS all titanium. They're sandblasted, they're easy to scan. You can pick them up on an x-ray, but most importantly, they can be sterilized multiple times. ELOS, so we're all bagging on Nobel here. ELOS is just kind of a nothing scan body. I mean, it's an okay. It does have a metal insert. The thing that I don't like about it is twofold. You can only send to a Procera certified lab. So if you have a lab that you love that is not Procera certified, you can't send cases to them. The other thing is they've got this wacky 3D printed analog models. I'm not going to spend a lot of time on printed implant analog models, but I love them. And the reason why I love them is I'm cheap. And so what I'll do is I'll take an impression, send it to a lab, they'll pour up a model for me. What do you do to save some money? You dig that little analog out, right? With 3D printed implant analog models, they're meant to be reused. So they have screws, and you actually screw in the analog in the implant model. So they've got some wacky tool. You need a degree in physics to use their models. So I'm not a big fan of the ELO system. Probably the best, but somehow limiting, are 3Shape's scan bodies. What I love about them is they are sandblasted titanium, but most importantly, if you're an office that restores different types of implants, they write the writing on the scan bodies in size 1 font, and it's just really hard to see. So what 3Shape has done is actually put barcodes on their scan bodies. So you can not only take x-rays, verify their seating, but when you scan them, if you enter in 3Shape the wrong implant, this will say, 4.2, Zimmer implant. And so it just knows which ones are based on the barcode. The absolute worst scan body in the history of scan bodies is actually Sirona's. What is the hardest thing in the world to scan in the mouth? Bright, shiny metal. What are they made of? Bright, shiny metal. And so some people have said they can get around that by sandblasting the scan bodies. But when you do that, you take the numbers off of it. So now you don't know what scan body it is. Furthermore, you've got to put this stupid little cap on the top of it and make sure it's all lined up. And I'm 50 and my eyes are going. So, it's kind of hard to see that. So dumb. One thing that's very important when you are doing digital hybrids is having the complete patient there. And so we can achieve that either through face scanning or by actually wrapping a photo. So depending on the software you have, you can take a photo. This is Sirec, where we can wrap the photo in Sirec. You don't have to. exocad and 3Shape both have this photo insert. It may not be wrapping, but at least get the photo. One of my first hybrids, I think the aesthetics are pretty good. What do you think? No. So I don't know if you know this handsome devil. This is Dr. Gerald Nisnik from Implant Direct, and he hasn't sued me yet, but we'll see. Yeah. So for free, there's a company called Bellis 3D. They make a free iPhone app. There's different levels of face scanner. Obviously, Zircon's on. You can mount a case with it. This is not meant to do this. You take a smiling and you take a retracted shot. This is available on the iPhone X and higher. You can buy a cheap Bellis camera for about $500 or a very detailed Bellis camera for $1,500 if you want to spend the money. But for me, the iPhone app works great. You have unlimited downloads for a day for $5. So if you're a super cheap person, you can scan all your patients during the week, and on Friday, download all the OBJ files. And OBJ, if you're not familiar, is a digital file, so an STL file with a photo wrap on it. Okay, so what is photogrammetry? It's a big word. Photogrammetry is initially designed to measure stuff, measure ships that go into docking bays to make sure the docking bay is big enough, or measure engine parts to make sure that the dimensions of the engine parts. They say that they can actually scan a tanker down to 100 microns is that accurate. And so there's two systems that we have in dentistry, the PIC dental system and the iMetric, and I'll talk to you about the differences of both. But the goal of digital hybrids is to have as passive a fit as we have with conventional hybrids. So our passivity, I can't speak, is that of a corrected cast. If you know a little bit about intraoral scanning, it's like taking a panoramic picture on your iPhone. We have to take multiple pictures that are stitched together using common data. The problem is as we go across the arch, micro inaccuracies compound so that we can have a cross-arch difference in a really good scanner of up to 0.5 millimeter. That means a restoration absolutely not fitting. So there are people that, in my opinion, just lie and say that you can just scan in the mouth 100% of the time, everything is dropping down. I have not seen that as the case. I've seen my success rate to be about 50%. And we can't operate a dental practice on a 50% success rate. If you notice in the picture over there, you see a tooth and sort of a tooth that's missing. So what you'll find with some intraoral scanners is everything's hunky-dory, you miss a spot, you go back, and the computer has to try to think to add those things. And that thinking leads to the inaccuracy. Oh, I got 13 minutes. So the best way is to mimic an extraoral scanner. An extraoral scanner can be accurate down to 3 microns. The reason why is it's on a benchtop. There's no spit, blood, or complaining. And an extraoral scanner takes minimal pictures. So whereas a intraoral scan on a full arch can be up to 500 individual pictures, most extraoral scanners are in the 30 to 50 range. So we want to mimic an extraoral scanner, and that's what the photogrammetry is. It is an extraoral camera. It looks like, some of them look like a robot or Wall-E, some look like an actual old Polaroid, and we take maybe 50 to 100 individual pictures extraorally. So the two big players are iMetric with the little dice and PIC dental with the little paddles. I've not played with PIC dental, so I can't speak to PIC dental, but I like iMetric better. The scan bodies are smaller, but you have to position them so that two sides of the dice show up. So you have the maximum amount of little dots. They're made out of milled aluminum. And so the dots are actually drill holes into the milled aluminum. So they can be sterilized multiple times and there's no peak at all. PIC, the paddles are pretty big. There's less dots. And the connection to the implant is plastic. So these can be deformed over time. The big difference between the two is price. So iMetric is about $20K. PIC dental, I've heard different stories ranging from $35 to $50K. The benefit of PIC over iMetric, however, is it can go implant level, whereas iMetric can only go multi-unit attachment level. So here's a case. Patient had a converted all-on-4. So we know the patient's midline. We know the patient's bite. Everything's cool. With iMetric, you take 2 scans. So you take one scan with these weird healing abutments on it just to capture the patient's soft tissue. Use your intraoral scanner of choice. And then another with the iMetric dominoes. They're merged together within the iMetric software and exported into exocad. And now they've just added 3 shapes, so they do both. So here's a patient. So we scanned the existing all-on-4. We're not going to necessarily copy the all-on-4. We're just going to use it as a guideline. And so we scan the soft tissue. It's put together in this cool Terminator looking dark gray. And the lab, in this case, Burbank Dental Lab, which I love, really, really great lab, designed the hybrids. And here we delivered it. I always like to go to a PMMA try-in before the final zirconia because you can see a lot of errors. So, we'll talk about 3D printed or PMMA being cheaper than zirconia. The big problem is tie bases. So tie bases range in price from $50 to $80 a tie base, and you got to be able to reuse it. And so you can always take a hybrid, stick it in a porcelain furnace, and put it on the glaze setting, and it should vaporize most of the acrylic. You'll breathe it in, but who wants to live forever, right? One thing that's interesting, and it was pointed out by another famous internet personality, that my AP spread is greatly violated on the lower. And as soon as I realized that, the patient called and they broke off both of the back saddles. So we also know that, hey lab, don't stick it all the way back. You can see we have way too much gingival display. The midline is good on this patient. The bite was excellent. So there's no occlusal adjustment at all. Very passive fit. And so now we can go ahead and go with the final, which I'll be inserting in 2 weeks. Here's another case, same deal. So we have an existing breaking down, converted all on 4. We converted the soft tissue, put the dice in, scanned those 2 scans. This time we added the Bellis 3D face camera. And again, it's virtually free. So the patient just takes the image like a selfie. So now we've got a lot of good information. We have the nose, we have the lips, we have the patient's midline. And so these can be converted. They're stitched together by the teeth, and you can see that the stitching is pretty close. We're not mounting, by the way, with the Bellis. So again, it's just for some data, just as good as a picture, but it's in 3D. And so here's, we delivered the case to the patient. She's chewing like a horse, so she's got to get used to that. But I think we got a great result. And again, we'll go straight to the final. Or we'll go to the final after it. So we have different types of hybrids. We have temporary hybrids or plastic, metal frame hybrids, solid zirconia, and component using enhanced polymers like Pecton. Just a quick side note. I volunteer at this homeless shelter in Phoenix. And for me, it's really fun because it's been a great education in doing digital hybrids. But the coolest thing about it, it's human experimentation. So these patients actually have a converted all-on-4 hybrid already. They've already got teeth, but they'd like to get better teeth. So what's wonderful about it is I get to test little theories that I see on the internet. Some guy says you take the bite this way. Some guy says, well, let's do a digital denture and let's do it this way. So I get to try it out on patients that aren't paying me, that can wait all day long, even come back the next day if I'm running late. So it's actually been a really nice thing for me. So 3 types of temporary hybrids. We've already talked about converted all-on-4s. I'll talk a little bit about, I spoke before about milled PMA. I want to talk about 3D printed hybrids. Spoiler alert, they're not there yet. And the reason why I say they're not there yet is if you think about 3D printed resins, 3D printing is printing a vat of Luxatemp. And you know that Luxatemp is not as strong as acrylic. And so as a result, someone with the intense biting force of upper and lower implants are going to destroy these. So I'm up to about 40 arches that we've scanned, and 100% of my 3D printed hybrids all broke within a week. So maybe I'm doing something wrong. We're using the carbon and using the carbon's resin. So we are using a good printer to print these, but they're all breaking. And so we've decided to move back to PMMA as our try-in. But let's talk about 3D printing. No, just kidding. So I'm not going to go too much into the different types of printers. If you want to come to my effing course, we'll spend 2 days on it. But I just wanted to say that the choice of a 3D printer really depends on the detail you need. So I'm a big fan of the Sprint Ray Pro. It's a nice DLP printer. However, the smallest it can resolve is 100 microns, which is not good enough for implant analog models, or if you want to do try-ins that are 3D printed. So you're going to have to get a higher resolution printer if you want to do that. I have one called the Asiga, which is a 60 micron printer that can do that. But for 99.9% of my general dentistry, I do love the Sprint Ray. Just a quick thing, I got married a year and a half ago to my lovely bride who will be joining me later on. As a dork that I am, I really wanted to make sure that things were okay with her ring. So I had the jeweler send me the STL. I printed it on my Form 2 printer, tried it on, make sure it looked good, and she reluctantly said yes. Another thing about 3D printing, actually, screw it, I'm going to skip this and get to some good part. Anyways, so one thing I've found with doing full arch cases is if you have a few teeth in there, it's always better to keep them, do the rest of the case guided, and then go back and do immediates on them. It just helps secure it. You don't always have the opportunity to do that, but for me, it does make things better. So we placed a few implants on this guy. We scanned with the OmniCam, which actually worked, which is surprising because OmniCam's a terrible scanner. So we scanned at the multi-unit level. I do not like scanning on the actual implant level. A lot of people will disagree with me, but there's so many variables to seating your hybrid, to making sure. Sure. All right. So let's talk about getting the bite. I don't know if a lot of you guys know, but your cone beam is actually a poor quality desktop scanner. So you can scan a human in it, you can scan your foot in it, but you can also scan and duplicate dentures. So what we do is we take the patient's dentures in occlusion. Corey's probably going to talk a lot about Mesh Mixer. We split the denture in half, and we put some blue mousse, and that is how we record the patient's bite. So we put blue mousse on either side, and we can actually cut the blue mousse and use that blue mousse on the contralateral side to scan the buccal bite. This was actually printed on the Envision Tech 1. We layered with Annex Gum composite, and we use this as an aesthetic try-in and to test the fit. And it was also pointed out to me by another internet personality that I gave the patient a perio abscess over there with the amount of gums that I did. So got to keep it real. So I am making perio funny. So here's the PMMA try-in. The patient was in this for about 4 months. Quick side note, if you do have a porcelain furnace, you can stick it in there and burn it out and recollect the tie bases and use them again. And here's his final zirconia. And so you can see here, this is no occlusal adjustment on this case. Going to keep going. One thing that you can do is scan a patient and print out the try-in in 2 different colors. So rather than layering it, you can scan the gums and scan the teeth. This guy had a monster lower arch. And in my opinion, if someone has a big fat lower arch, you'll have a higher success rate scanning without photogrammetry because you have more landmarks. It's the people with the skinny arches, which in my opinion is a lot of people, that are hard to scan without photogrammetry. So this actually fit without photogrammetry. We put markings so we could relate the scan body scan to the bite scan. These were printed in 2 different materials. And here it is. And you can see here, it's not pretty. But again, this is a glorified wax try-in. He can go home. I don't know if he's married, or he can see his spouse, show them, haul ass back to the clinic within a week because it's probably going to break. It's so funny getting this guy to smile and open up. I just wanted to get in there and grab his lips. All right, so I got 2 minutes. Quick side note, Philip was showing orange PVS. You can actually, we use Instagums, which is a material from Stern Gold, which is a PVS material over our temporaries. And so we don't put Teflon tape or anything. We just fill them up as a temporary. This is not for the final. So it's in between the try-in and the final. Just a quick note, I went to the True Abutment Symposium, and it was really interesting because a lot of speakers got up and really poo-pooed digital hybrids, and they would say stuff, and I would ask them questions, and they wouldn't really tell me stuff. So there's one guy showed a case, and I asked him how he got his bite. And he says, oh, no, I just did facial thirds. I just looked at the facial thirds, squirt some blue mousse in there, and we're off to the races. I'm like, cool, let's try it out. So if you take your finger and hook it under your nose and put it in between your eyeballs, bite together, and put this underneath, it gives you an approximation of what your facial third is. So we measured this patient's facial third, threw in a ton of blue mousse, scanned the patient up, sent it off to the designer, and I thought, cool. No problem. This is going to work great. So this is the try-in we did. Something that's off. Is it the golden proportion? His frickin' tooth is all the way over to the left, right? So what had happened was when the patient was biting on the blue mousse, he just went like this. And the lab just designed the whole denture that way. So that didn't work. So I was at the True Abutment Symposium, and they said, hey, what you should do is just have them bite on the scan bodies. Scan bodies are about 12 millimeters long, roughly the length of a tooth. No problem. What the hell? Let's try it. So I rescan him with him biting on the scan bodies, which is a bad idea. I mean, think about it. You're going to be teetering on one scan body. But we went ahead and milled it out. You can see my midline is slightly off in the temporary and then corrected in the final. So it got the job done. But the take-home message is, don't do that. 3D print something, do something so you can capture the patient's bite so that you're not guessing. Okay, so I've got to close it up here. Let's see what else I have. I got one case. Let me just bust this out really quick. So I was at the True Abutment Symposium, and this guy said, well, I used a Trios, and I scanned intraorally for a digital denture. And I'm like, well, hey, how'd you get the borders? Because with digital dentures, you still need to take a border mold impression. He goes, I just grabbed the cheek out and pulled it straight out. Cool, let's give it a try. So the hapless patient walked in. We decided to do it. We wanted to try implant level hybrid with Pecton opposing a digital denture. And sure enough, pulled his cheek out. I made this little bite jig from a scanned upper and lower. I got a little crazy with the white composite. Again, these are used to stitch the two together. The lab milled out the Pecton framework and did Emax crowns on top of the Pecton. Pecton's a neat material because it's a lot lighter than zirconia. Patients don't make the clackety-clacky sound. And also, it's supposed to have an elastic modulus similar to bone. And people say that it has a little give. So it aids if your implants aren't totally, or your restoration's not totally passive. So here's the delivery. I promise you he's biting weird. He actually did bite down. But I think that we got a pretty cool result. To be honest with you, on the upper, I got lucky. There's just no way in hell you can take an intraoral scan for a denture and get proper borders. It's just impossible. But worth a try. Again, human experimentation at its finest. So anyways, thank you for your attention. Again, my name is August D. Oliveira. You can find me online at Digital Enamel and ask me whatever you want. I won't ask you to take the epic course.